Today we're going to do a hand draw and a safe redirect. So I'm going to go through the 20 steps and show you how to do the hand draw on the mannequin arm with a safe redirect. You're allowed to do one safe redirect per draw. If you have to do another safe redirect, you have to stop the draw and start over again. So first step number one, make sure you have your paperwork ready, that you know exactly what test you're going to be drawing, and that you have the equipment available to do the draw. So you're going to review your test request and make sure you have all your information. Then you're going to approach your subject and state, "Hi, I am Officer Beth. I'm here to draw your blood today. Is that okay?" And get a verbal consent. So we're going to assume that we get verbal consent on this draw. If you can't get verbal consent, you will have to get a warrant. So we have verbal consent, and then I say, "Can you please verify your full name and date of birth for me?"
Yes.
And your subject will verify your full name and date of birth for you. Once you have that information, and you know you are drawing the right person with the right equipment, then you get your tourniquet. And, I'm sorry, you don't get your tourniquet. You sanitize your hands. For police officers who are doing draws for forensic evidence, you must document that you have rubbed your hands until they are completely dry. So in order for you to be able to testify in court that the alcohol on your hands did not affect your draw, the only way you'll be able to do that is if you have verified that you have completely rubbed your hands until they are 100% dry, and that you document that on your blood draw report. Put your gloves on. Before you touch your subject, and now we take our tourniquet. So this is going to be a hand draw. So this assumes that you've already checked your antecubital area and you could not find any usable veins in the antecubital area. So we're going to do, the next step is to go to the dorsal surface of the hand, which is the back of the hand. So for this draw, it's best if you sit, because you want the hand to be lower than the heart. And the reason is that will help the blood flow come down into the hand and get more blood flow into the hand veins. So you want that arm hanging down, but at least below the level of the heart, even a little bit lower if you can manage that. Put your tourniquet on. And again, the dorsal area is here. So we're going 3 to 4 inches above. So I actually got my tourniquet a little bit too high. I want it down a little bit further. So we are going to look for the veins in the hand, and what you want to find is a nice straight section on the vein. So we have nice veins along here and here. You may even find one over in this area or over in this area. What you want is a section of the vein that's about 1 inch that is nice and straight. You want to avoid the curvy areas if you can. The tricky part with a hand vein is the anchoring, but we'll get to that in a minute. So we're going to palpate our vein the same as we do in the antecubital fossa, and we're going to find a vein that is pliable, soft, squishy, and we're going to note what direction it's going in. We're going to note how deep it is. Usually hand veins are very superficial, meaning they're very close to the surface of the skin, and so we're going to know that when we go in, we're going to be at a shallow angle with our needle. And we also want to check the diameter. Make sure that a 21 gauge butterfly needle will work for that vein. So once I find my vein, I'm going to remove my tourniquet, get my BZK, which I'm just actually going to use an alcohol for the moment, but this would be a BZK. We're going to scrub to clean the vein. Just scrub it a couple of times. That can go in the trash. And while I am waiting for that to dry, I'm going to gather my equipment. So for the hand draw, we're going to do a butterfly syringe because those are typically small, fragile veins. and this will work best. I need to get my butterfly needle, I need to get my syringe, my gauze, my transfer device, and my tubes. In the class, in the clinical class, we're going to have these little buckets. So you can use these little buckets if you want to hold your supplies, or you can just set them on the clean surface. Either way is fine. We will open up the butterfly needle. If you haven't already watched the previous video with the 20 steps that show how to put together the equipment, please watch that video. But I'm just opening my packages at the moment and leaving them in the container so that the ends will stay sterile. With the butterfly, it comes with a sleeve on there. That could go in the trash. This is the end. There's a needle at each end. Do not touch the gray rubber covering that's over the needle. But we are going to have to remove that to attach our syringe. So I'm going to twist. This goes in the sharps. This attaches right onto the syringe. It just twists on. I'm going to pop that seal at this where the syringe is. There's a little bit of a seal here, so I'm going to just break that little seal. Now my needle is ready. I can set it in my bucket or I can set it on my clean surface. I have my gauze. I'm going to quarter that so it's ready to go. Put it in my little bucket. I won't need my Coban right away, but I will need it at the end of the draw, so I'm going to make sure I have that. Once my equipment is together, my BZK is now dry. I'm going to come back. Oops, where did I do with my tourniquet? Oh, here it is. And I'm going to bring my tourniquet. Put my tourniquet back on my site without contaminating my site with the ends of the tourniquet tail. Tuck, tuck, tuck. And I'm going to have my, so to anchor these, it's a little tricky with the fingers. You'll probably want to have your hand underneath. So my non-dominant hand I'm going to anchor, and I'm going to probably wrap it between their fingers. And then I'm going to anchor this way. So once I get my needle, again, I'm going to put it so that the wings have bumps. The bumpy sides are down. When the bumpy sides are down, the bevel is up. I'm going to twist before I pull. I can set that on my surface. I'm going to hold it by one wing. I'm going to twist my syringe just a little bit so I can put it in my hand to get it out of the way. My non-dominant hand, I'm going to anchor the vein. With these veins, you have to anchor really hard because they roll super easy. So once I've anchored, I will get my bevel up, inspect my needle, make sure it looks okay. I say you're going to feel a little poke, and I go in at a very shallow angle. So you can see I'm only at about a 10-degree angle because I'm going to catch that vein. So let's pretend that I miss. I'm right next to the vein. So now my needle's in and I'm right next to the vein. I do not see a flash of blood. I know I'm not in the vein. I need to redirect. You're allowed one safe redirect per draw. And what that means, if I move my needle right now, it will turn towards the vein, but the end of the needle, because this is your fulcrum, so the end of the needle is actually moving under the skin. And you saw how sharp the end of the needle was. It's actually cutting the cells and the blood vessels and nerves that are in the skin in this area. So I don't want to move the needle while it's in the skin like that. I want to anchor again, pull back until just the bevel is under the skin. You don't want to come all the way out. If you come all the way out, you've finished your draw and you have to start over. So I want to come all the way back till just the bevel is underneath the skin, and then I can move my needle to the right direction. This way I'm not cutting tissue, veins, capillaries, arteries, and nerves while I'm moving the needle. So I'm almost out, turn, and then I anchor really hard again, and now I can put my needle into the vein. So once you're in the vein, hopefully I'm in the vein,
I can draw back on my syringe. I'm not in the vein. I'm just going to reposition this again so that I'm in the vein properly. There's actual tubing in there. There we go. I think I'm in now. There. So you don't really want to let go of your needle. If you can, with a butterfly, you can let go just for a smidge, but you don't want to let go very long. So once it's in, then I will, sorry, I'm doing this wrong. Once it's in, I will put my syringe in my non-dominant hand across my palm, use my thumb, pull back on the syringe. And make sure you get enough blood to fill your tubes. If you're filling two 10 ml tubes, you're going to need a 20 ml syringe. Once your syringe is full, I'm going to ask my assistant to bring my tray over here where my gauze is. I'm going to pop my tourniquet. Gently lay the gauze above where the needle is coming out. Don't push yet. You're going to pull, push. With the butterfly, you can't safety until you have both hands, so we're going to ask to hold. And now for the butterfly, again, to safety it, it's a 1. So 1 is holding the wing, 2 is holding way down low where the little lines are on the safety, 3 is then grabbing the tubing here, pulling, and now it's safetied. I'm going to pull back just a little bit to get the last bit of blood from the tubing into my syringe. My subject is now holding pressure. That's going to start the clotting process in the hand, on the vein in the hand. And I'm going to come over here. I'm going to remove my needle, hold my syringe upright so the blood doesn't drip. My needle then goes directly into my sharps container. Pick up my transfer device, and it goes onto the needle or onto the syringe. Now I can turn it over. So if there's any air in my syringe, it's now going to be here, and it's not going to go into my tubes. Take out my first tube, fill it. There's no vacuum in this tube, sorry. Very little. Let it fill as much as it's going to fill. You never, ever, ever push on the plunger. Once your tube is full, 1, 2, 3, 4, 5, 6, 7, 8. Pick up my second tube and fill it. And it will take as much blood as it's going to take. Again, never ever push on the plunger. If you push on the plunger, you're putting too much pressure inside the tube. And if this tube is going to go into a centrifuge, which this will, once it's in the centrifuge, if there's too much pressure inside the tube, the top will pop off in the centrifuge and the blood will go everywhere. So that's why we never push the blood into the tube. We only let it take what it needs to take. 1, 2, 3, 4, 5, 6, 7, 8. This whole piece goes directly into the sharps. Then we label our tubes. Once our tubes are labeled, we will show them to the subject and verify that the information on the label is correct. The label must have the full name, date of birth of the subject, the date and time that it was drawn, and the initials of the person who drew the blood must be on the labels. Once they are verified, they will be packaged in the evidence kit and sent to the lab. At this point, now we take our Coban. Again, pull off about this much. Put your thumb at the top of the Coban and pull towards you, and that will tear the Coban. We come back to our subject, and we just double check, make sure it's not bleeding. 1, 2, 3. For the hand, we want to put the Coban on here so that it's going to hold this in place. So if I just wrap it straight across here, it might slip this way. If I wrap it straight across here, it might not hold it in place. So it's going to be a figure 8 kind of wrap. So it goes under the thumb, across the palm, over. Try not to twist it too much. Holding pressure the whole time, above the thumb, under the palm, and then back around here. I probably should have made it a little bit longer because it would be nice if this end actually ended here, and then there would be double coverage there. But now I have a nice firm pressure on the site, and it's not going to slip off the hand easily. And then you will tell your
Subject, please leave this bandage on for 15 minutes. No heavy lifting with this hand or arm for 1 hour. The reason we say no heavy lifting is because we want to give this vein time to heal. And if you lift anything heavy with this arm or hand before the clot has fully formed, it will pop off the vein and they could bleed again and they end up with a bruise or a hematoma. So that's why we say no heavy lifting with this arm or hand. And then we double check with our subject. Are you feeling okay? If the subject is feeling okay, you're done with the draw. If the subject is not feeling okay, you may end up having to activate EMS or just have them sit for a little bit and see if that if they feel better after that. And that is the end of the draw. Thank you.